And we're going to do a talk about your journey with your prostate cancer, which many people don't know that you were diagnosed. And they, obviously it's a personal thing, but a lot of men don't like to talk about it. They don't want to get the test. They don't want to even know if they have it because of the process. It's the process, you would say, that keeps them from even going to find out.
Right.
Okay. So the reason I wanted to do it, and I appreciate you agreeing to do it because it is a personal thing and you didn't have to say you would, because I think that by you sharing and having so many people know you and know who you are, have been exposed to you, have interacted with you, for you to be able to share it would hopefully, my hope is that it will influence or encourage other men, especially our men, Black men, to go ahead and at least take the test, take that first step. Right. To take the test. Mm-hmm. And thereby. So in recent weeks, we've had about 3 well-known cases. Yeah. That was kind of surprising. So I wanted to do that, and I appreciate you doing that. Now, tell me, what is the first step? The first step, that is it the actual physical prostate exam, or is something happened before then? What is it that tells you, what is the trigger for prostate cancer, or the likelihood that prostate cancer may be developing? What is the trigger?
The trigger for most people is going to be a PSA count that occurs after you have a lab test. Okay. PSA is prostate. That's a prostate specific antigen. Okay. That's the one that tells us, depending upon how high the number is, what the probability for you having cancer or obtaining cancer is. That's what your doctor will be able to tell you once you have done a lab test.
Okay. So the lab test is actually the first step.
Yes.
Okay. So that the results of that lab test then will lead, if the PSA numbers. Now, what are these numbers? What is the what is the safety level and the critical level?
Anything between 0 and 4 is considered relatively normal. Okay. Once it gets out of 4, 5, 6, 7, 8, 9, and 10, that's when the alarm bells go off. Okay. In my case, the alarm bell went off for my primary care physician, because I was not seeing a urologist and certainly not seeing an oncologist. Oncologists are the ones that actually handle cancer cases. Urology is something you go to on a normal basis, and that's what most men hate, to have a urology exam. But anyway, right. The alarm bell went off for me when my primary care physician, after I'd done my annual physical exam, discovered that my PSA was at 27.
Wow. 27.
Yes.
But at that time, though, were you considered to have prostate cancer or just a high PSA level?
Well, a high PSA level, but at that number, since it was totally out of norm for me, then the word cancer had to come up because of that high PSA. And again, I had been going to my physical exams about 2 years prior to this particular time. So for me, everything was okay. But this number popped in after the latest physical exam, and that's what prompted I didn't get a call from the doctor's nurse, which is what you normally would get. I got a call from the doctor.
From the doctor.
And I could tell the panic in her voice. I had that said, "Mr. Matthews, you need to come in immediately. We need to check." And I knew that something was really up. So that was the key. The number bespeaks of the probable instance of prostate cancer.
But now I know you shared with me some time ago that you also know a gentleman who is maybe older than you, who has a high PSA, but no cancer.
Yeah, I've known this gentleman for quite some time. We've had a lot of discussions. about this at the bar, and he has had a PSA between 20 and 24 and has not had a problem with that. I don't think he's even had any surgery or anything going forth with it. I don't know if he's been on any chemical castration drugs. I don't believe he has, from what he's told me. Mm-hmm. He just has a higher than normal PSA. And in my discussion with the urologists that I've had over the years, and the reading up on this, that is not terribly unusual. It's like anything else. Your blood pressure at high may not be the same thing as my blood pressure at high.
Right.
We're all different. But the key is that you have to look out for the spread of it. And again, for African American men, it's right now it's the second largest killer. Right behind lung cancer now is prostate cancer, and then heart disease. So we have to be on it. And my doctors felt that in my case, it was something that they really needed to jump on and try to handle immediately.
Now, you don't have a family history of cancer, do you?
Only, I think my father had lung cancer as a result of years of smoking and working at the shipyards in the hull of ships. What we call they had to spray out the hulls of ships that came into port, but that was as a result of smoking.
So that was that. So now you have your diagnosis, and you're ready to start this journey of treatment. How did that go? How did it, what was your first, second, and third level, and where are you now with that?
Well, it pretty much has been the same for the past 12 years that I've been engaged in for everybody. The diagnosis is there. The initial sit is with the urologist, and that's the part that a lot of men don't like, because there are two ways to examine your prostate, and most men were afraid they're going to stick something up your penis, and everybody hates that. The other thing is having somebody stick two fingers up your anus to try to feel your prostate and feel it. Well, I went through that through several doctor's visits. It was determined that I did have some lumps on my prostate, and the options. And once they determined that the lumps, of course, were cancerous, then comes the decision as to what you want to do about it. So you have the quick, fast thing to do about it was to have surgery. Have a radical surgery, go in, remove your prostate, which sits, by the way, right on your intestines. It's just below your bladder, and it sits right down your intestines. So when they go in there, there's always that chance they're going to clip part of your intestines while they're taking it out, and you're going to walk around with a pee bag for a couple of months until everything heals up.
Right.
The key with that for me is that they could not give me a guarantee that would end the cancer. Okay. They couldn't guarantee me that it hadn't spread, that it wouldn't have spread by the time they got to the surgery. They couldn't give me any guarantees about that, other than they would cut me open and go in there and remove a part of my body. For me, I'm not crazy about that. Now, there are other people who went for the surgery as the quick, fast, early approach, and for many of them it's worked. But for others, it has not. It continued. It had already spread, and they couldn't guarantee me of that. So then we look at alternatives that they have in play.
Okay, and so you chose the alternatives, and what were what were the ones that you chose?
I went pretty much through all of the options that they had in play. The first one that I went to was a sort of a proton, the early approach to proton therapy, where they literally put an X across where my prostate would be, and every day for about 5 days a week for a month, I'd go in and they literally bombard my prostate with radiation. Okay. It wasn't a full radiation where I had to lose my hair and all that. They just bombarded that part 5 days a week with radiation. And I went to a particular cancer center. That's pretty much all they did. And they did that. And that didn't fix anything.
Did you have side effects from that radiation though?
Not that I remember.
Okay.
I don't recall even having any pain over there. The problem, I think the side effects that I had would have been that I didn't know at that juncture was that I was also getting a chemical castration. At that has started. And because I was working retail at the time as a store manager, and the first thing I noticed, I had a weight gain. I started developing hot flashes, and my attitude overall began to change in that early stages of it. So I went through that phase of it. Then they took me. Then they tried what they said cryotherapy, where another set of cancer specialists took me in, and they basically tried to freeze out the cancer, much as you do with these skin tags. They put ice around it. One of the therapists put ice around it, the skin tag just falls off.
Right.
Well, I went through that for about a couple of months or so ago, and that really didn't do anything. It didn't lower. I mean, had a momentary lowering of PSA, but it did not cure the cancer, so to speak. It just wasn't there. And I think that was the others that we had. There were no studies, as there are not to this day. There are no studies about prostate cancer that have led to a cure. So for me, what has worked, and the closest thing that's been there, because I haven't experienced a spread, is that I opted for chemical castration. That's what it's called. It's not really castration, but that's what it's called. And basically, I take a shot twice a year, and that has lowered my PSA to many cases 0. In many cases, it's been 0. I take it, and it's done. I've been on that shot for the past, I guess from the beginning, but from the time that I know it, it's been about 10 years.
So if you say you're doing this shot now twice a year.
Yes.
So in between, let's say you take the shot in January, and then you take the next one, 6 months later in June. Between January and June or July, does your PSA level begin to rise again?
It can. But in most years, it did not.
Okay.
I kept my PSA level well below 4, maybe most of the time at 0. Certainly, as time goes on, because what the chemical does is that it lowers your testosterone. Testosterone is what feeds the cancer, and by lowering that, which essentially is giving you a female hormone. That's the word castration. It gives you a female hormone that lowers the PSA level and keeps the blood and keeps the cancer from feeding off of testosterone, and that's what has tended to work. The issues, of course, around that is that you could have a weight gain, which is what I had, and all the accompanying things that many women will go through in menopause. It's likened to that. That's what it was likened to me. Is it watching when you went through menopause? It's watching what you went through during that period of time, physically, mentally, emotionally. Well, that's what it is on that end. And many, men don't notice that until it comes upon them, especially the side of the things that depression and hot flashes. And are the biggest things.
Okay, well, you mentioned depression. Talk about that a little bit. How did you deal with that, and how does, because again, we're talking about what as we know depression to be a mental health issue, and even though we're getting more in tune with understanding and believing that Black folks can actually have mental health issues, it's still not a thing is for men that they are willing to necessarily deal with, especially men of your age group from your time period. That no, it's not, that you need to straighten up and that kind of thing. So, but this depression that you're describing is more, I guess, for lack of a better term, a drug induced depression from based on the treatment.
Right.
So so are you taking the medication for it, getting any counseling for it? How does it affect you, the depression, when it comes?
Well, in the beginning, it is something that you had to that I educated myself about, because there wasn't anything out there. The oncologist didn't, aside from telling us that you wouldn't want to have sex anymore, there wasn't anything else. The depression was not in the lecture. The hot flashes were side thing, and the mood changes, those are side effects as they give, but there was no warning about the depression part of that. I had to educate myself about that end of it, because like depression is for anybody, it comes upon you. It's like a cloud that rolls right over you and in you, and it is something else, because you are in many cases, for me, it brought me to tears sometimes, just when I was sitting alone, watching TV or listening. It came upon you, and it can be overwhelming. What I had to learn to do first was to understand what it was. And that, I hadn't necessarily had done anything to make myself depressed or mad or angry or just plain sad.
Right.
But that this was a part of the chemically induced process that I was in. And understand, sort of look at a timeline that this particular phase would pass, and understand that, so that I wouldn't do anything ridiculous.
Right.
Okay. Right. That was the biggest part of it. I had to, warn my store employees that if I was shouting at them, it wasn't because I was angry or anything. It's just because I'm taking this medication, and sometimes it has me more excitable than others.
Right.
But there were points in times when I was at the store, and literally it came upon me when I was stocking. I had to get down on one knee and wait for this thing to pass, because it was driving me to tears. And I can, one day my district managers came in and saw me on one knee, and I looking like I needed to get out of there. They said, "Okay, Mr. Matthews, let's do something else." And I went to do back to assistant managers for a while in a couple of stores. But that's the thing. You have to educate yourself. There's no getting around that. And many people don't do that part of this thing. Doctors have practice, and that's it. They just practice on you until they see what's right. We as patients have to educate ourselves, and we as men have to know what we're getting into. There's no necessarily right choice, but you have to understand whatever choice you make, what comes with it.
So the depression doesn't last. It comes.
Yes.
It comes and goes.
That's right. It comes and goes. Okay. And for a while, I opted only to take one shot a year because of that.
Okay.
My PSA was staying down a decent level. The farther away I got from taking the injection, the better I felt physically, and I could get on with my running and jumping and all those kind of things physical activity I was doing. But as the numbers began to creep back up over the last couple of years, I decided to go back on twice a year.
Okay. All right. So it's been how many years now?
It's been 12 years.
Okay.
12 years.
12 years.
Yeah.
And how do you feel?
I feel pretty good. I know what to expect. I don't have as much hot flashes as I had, but the mood swings are the biggest thing that do come in. They're still there. They're especially immediate within days of taking the shot. The mood swings come in, and I still got this gut here from taking the shots over the years, and I just need to do more crunches. But I don't have you have to have a lot of energy to do all that. And for me, power walking and that kind of thing helps me to get my whatever that is that gets you going. Endorphins. I feel much better after a power walk and that kind of thing on the treadmill, all that, than I do anything else. That gets it going, and I feel much better. But it's lowered. There's been I've gone through a full body scan. There's no indication for me of any spread of any kind anywhere. I got the same aches and pains of anybody my age,
but not cancer.
But not cancer.
Okay. So I appreciate you agreeing to share this with me and with others. As the um, better or worse part, I can tell you that the um, the shot and the effect that it had on his personality was overwhelming for me, because those of you that know him know his spirit is quiet and gentle, and that shot in the beginning changed his attitude and his personality, and I just I had to adjust, but with his help, because he was, as he said, he was educating himself on what was happening to him and why. And so when he got past the when the depression passed and he was back to normal, which was not, I mean, like he said, it come and go. um so it wasn't like we went days and days and days. It's not like that. But it's just that the time, if it's a couple of hours, it and you're interacting with him, then it can seem a bit much. But and through these 12 years, he has educated himself and me on that. So now when he has the shots, I know what to expect. And I say, okay, so what we looking at? 1 day, 2 days before we, and it's like, we kind of smile about it now, but it was serious in the beginning, and I'm glad he was able to get a handle on it so that we could get a handle on it together. But you have to be supportive. You have to, as a wife or girlfriend or children, you can't be judgmental. You have to be supportive. You have to be patient. Um, and sometimes you just have to walk away because you know that that's not your loved one. That's the medicine. And then in a couple of hours, you come back and your loved one is sitting right there. So, and as he said, it passes. Time, it passes. And so now you don't get the depression as much as you did.
No.
Okay, but the hot flashes and all that, and I think the hot flashes are cute because we went through it. I think that's really cute. But but on a serious note, we really did this because we wanted to send a message and reach out to our African American families, not just the men, because the men have to go through that, and there's nothing to be ashamed or embarrassed about, because look at it as you saving your life. And what would your family and what would their lives be without you? Um, I've threatened him. He cannot leave me here. And so he's doing everything he can not to leave me here. And you have to be patient and supportive, and encourage them to get those exams. They're so important. As many of you may know, Martin Luther King's youngest son recently passed away from prostate cancer. And we had one of our city councilmen treated for prostate cancer. And the Secretary of Defense, prostate cancer. And there have been countless others. So we have to take it seriously. And encourage your husband, your boyfriend, your sons to get the prostate exam. Again, it starts with a blood test. It starts with the blood test. If the PSA level is what?
Above 4.
Then you have some decisions to make. When does this test start?
It should be part of your annual examination. Everybody over 40 years old should be getting it. It should start with an annual examination, which includes lab tests and everything, and checking out your whole body. So a lab test with the examination is something you should do. Every man should be doing that anyway if you're over 40. It used to be you could wait till you're 50 or 60. It don't wait no more. No. It's if you want to be post 40 years old, if you haven't gone to have an annual exam, you should be having one. Lab tests are part of that, and you look for the PSA number.
Right. So we hope that this message will get through and resonate, and that you'll take it for what it is. Our desire to save our families and our Black men. And so with that, Mr. Matthews, out of all that you've shared with us, out of everything that you said and all that you've gone through and still going through, do you have any regrets or second thoughts about the choices you made for your treatment going forward? Would you do it again, basically?
Yes, I would. For me, it was fine. I don't want to be cut on.
No, that part has not changed.
That part hasn't changed.
Okay.
I don't want to be cut on. If they cut on me and they could assure me it's going to be done, that'd be fine.
Yeah.
But look what happened to General recently. He got cut on. It didn't work. Yeah. So like it should. Right. So, but for me, what I've gone through is I found to be best for me. Gave me the best peace of mind, and I had to change the lifestyle a bit. My work style and that kind of thing, but no, I'd probably do the same thing again.
And I think, again, based on what you said, if you had all of the information, if the doctors had shared all of the information, so this video that we're doing, he's sharing some information with you that your doctors and neurologists may not share, which could also influence the decision that you make for yourself, which is what he's saying. Had he had information going forward, then he never would have chosen surgery. That's clear. But he might have chosen something else earlier, or he would have been able to do more research, or maybe even get into a study before. But so that's why he keeps saying, educate yourself, know what you're stepping into, and if you are diagnosed, talk to your doctor. Ask him questions. It's your body. You have the right to ask him as many questions. And if he don't want to answer those questions, find another one who will. Yeah. This is all we got. And so we have a right to protect it and know what to do and what to expect. I appreciate my husband for doing this for me. And I really hope that it is beneficial and that it does help to save some lives. Any closing comments, sir?
I don't think we've covered all the waterfronts. Get checked.